It is estimated that between 30 to 40% of the UK population snore, and over 1/3 of people who struggle to sleep blame their partner's snoring. Snoring is the vibration of respiratory structures and the resulting sound due to obstructed air movement during breathing when sleeping. Snoring is often caused by relaxation of the uvula and the soft palate, but can also be associated with a malpositioned jaw, obesity, obstruction in the nasal passageway, enlarged tonsils and adenoids, obstructive sleep apnea, relaxants such as alcohol, and sleeping positions such as lying on one's back. Inadequate quality and interrupted sleep can cause daily fatigue, irritability, poor concentration, headaches, reduced productivity, and decreased libido. Our advanced Er YAG 2940nm laser produces a matrix of microscopic laser beams to gently drill into the anterior tonsillar pillar, soft palate, and base of the uvula. The result is scar formation that causes fibrosis, stiffening, and strengthening. A full medical assessment, including ENT examination of the throat and nasal passageway, is required prior to laser treatment to exclude additional anatomical causes of snoring. So, why choose our laser snoring treatment? We offer a fast walk-in, walk-out procedure with no downtime and immediate return to normal activities. No anesthesia is required and the procedure is virtually pain-free. We usually recommend 3 treatments at monthly intervals, and a top-up treatment may be required every 6 months to 1 year. So, if snoring is affecting your well-being or disturbing those around you, why not call our team of experts today to book your free consultation?